So I'm out here at this trauma conference. It's at this Church of the Apostolic Faith. And this is the back area. Having a cigarette, didn't want to stand by the door and be smoking at church, you know. Garden space, a bandstand. Nice beautiful field. Hearth. In ancient times, people's houses were made out of grass, so you would keep your hearth outside, and that's why there's the phrase hearth and home instead of, just welcoming you to my home. You wouldn't have your hearth in the house because it would set your house on fire. You would have a hearth outside. And that's essentially what this is.
Like I said, restorative and resilience building practices that can be done really anytime, but are also helpful for when the stress response, when the threat response is really pumping, and that's the great question that Shruba asked, as well as to do some sort of experiential work around how to conceptualize the three brains. Now, the three brains is obviously, it's a metaphor. It's not technically, it's not really, it's actually a useful metaphor. So the lizard brain being sort of the brain stem, controlling the autonomic nervous system. The mammalian brain, or the neo-mammalian cortex, is the social brain, or the limbic system, which includes structures like the hippocampus, the amygdala, and the ventromedial prefrontal cortex. This is what I was calling the danger center. Amygdala is the danger center. The VMPFC is sort of the all good center. I will send you, if people want these slides, I can see if I can get your addresses from the registration and send them out to everybody.
I can take them down and I can send them out.
Okay.
Sean Smith will be able to get them out.
And then the final brain is the thinking brain. So what I wanted to say about this is these brains speak different languages. Okay? The thinking brain, if you're an English speaker, the thinking brain speaks English. Right? It's semantic, it's logical, it's rational. It has all of these, it can do math. It can do all of these sorts of things. It can also think about the future, the past, all these things. But what it can't do is regulate our emotions directly. Right? So the lizard brain, it's kind of like this, is the brain stem and the pons. This is what keeps us alive. This is what controls our heartbeat, controls our blood pressure, and importantly controls our metabolism. And it responds. It's sort of like a lizard. It doesn't know pain or pleasure or threat. In between, we have something called the mammalian brain. And the mammalian brain, as I was saying, has these kind of coordinates. So the mammalian brain can actually send messages to the lizard brain when we're in threat, when something really needs to happen. But the mammalian brain speaks its own language. It doesn't speak English. It speaks the language of emotion. And the analogy that I kind of like is we all know, has anybody got a dog? Mm-hmm. Can you talk to your dog? Mm-hmm. Yeah. Yes. You can definitely talk to your dog. Does your dog understand English?
Yeah.
Maybe.
Yeah.
But that's true. They know a couple words because they remember but what they really can understand is you're telling us. Right? They get it immediately. So if you tell your dog, there's a very low likelihood of danger imminent within the next kilometer. They'll look at it. But if you say, it's okay, come on, puppy. Then the dog would totally understand it. But the lizard brain doesn't even understand that. So go up to a lizard and say, oh, it's okay, how you doing, lizard? No, I mean, maybe a particularly special lizard. Most lizards don't really get emotion. So that's an analogy for how we have to work. We can't just tell ourselves everything. Well, I don't know, we can. And eventually, anybody go down a really scary place, dark alley late at night, say, it's safe, I know it's safe, everything's safe. But still you feel maybe a little bit, a little something going on. So your mammalian brain is the one that tells you it's safe. It knows it's safe through experience. And I think that's really all that I wanted to say. The sympathetic nervous system, we are going to work with, I did want to show this. So we talked a lot about trauma, but other things other than trauma also impact the same threat systems. So this nasty boss was showing a poor guy, that's like leaving, oh, sorry. You know, this is not trauma, right? This is annoying, it's hurtful maybe, it's upsetting. It's actually activating a lot of the exact same threat pathways. So the idea is that if you continue, so it's not trauma, but lots of stress, continuing stress, ongoing stress, and worry. So this also activates the same stress area. Boss is not there, right? Boss is in the head. It's memory. That's also activating your same stress responses. So continuous activation of stress responses, well, makes us feel lousy. It also is not healthy. And so finding ways to balance, finding ways to balance, you know, the automatic sympathetic nervous system activation that we find ourselves all the time is an important part of self-care. And particularly for people who've been exposed to trauma, because their adrenaline system is pumping in overdrive. So that's all I wanted to show for slides. We're going to shift bases, but any discussion on that or any questions people have?
I have a bit of a question. You say that you know, work stress stuff is not trauma, but I would want to argue that isn't having your job on the line, getting dressed down from peers, worrying about losing your job and losing your kids, maybe a racist work environment that's chronic, wouldn't that qualify as trauma?
It's a good point. Good point. I think it can. And actually, interestingly enough, so certainly, you know, your job is on the line, and I mean, this is a horrible thing, especially if you have to kind of suck up some nastiness because you just got to do it because you have to. That's harmful. When I say trauma, I mean there's no life threat, but in a sense you're right. There could be sort of a fear of a life threat, or what's my family, how am I going to work, how am I going to feed my kids? So, good point.
Anxiety.
And in addition to that,
Every day, all day. Thanks for
oh yes. So, other funny thing about social threat is that evolutionarily, what's the scariest thing? Anybody know what the number one fear is? By the way, it's not death.
Failure.
Oh, spiders are up there.
Being alone forever.
Being alone forever, that's what terrifies me. So you got it. Apparently, when they asked these I got this from Seinfeld. I'm dating myself. So the number one fear.
Public speaking.
Public speaking. That's right.
Oh, yeah.
Public speaking is the number one fear.
Did you watch Seinfeld?
The second one.
Occasionally.
It's funny because death is the second one. So he's making the joke that, you know, when somebody's giving you a eulogy, they'd rather be in the box. Which is, of course, not true. But anyway, so why is public speaking so terrifying? Or why is social scrutiny? Well, if you think about it, in the old days, I mean the really, really old days, when we lived in Africa, when everybody lived in Africa, and we lived in small groups, hunter-gatherer societies, if you get excluded from the group, so if you look like, for example, like in other mammals, like rhesus monkeys, the lifespan of them, so rhesus monkeys kick bad behaviors out. They kick them out of the tribe. How long does a rhesus monkey live outside the tribe? 2 days.
Wow.
Wow.
They're not fit. I mean, as a group, they're powerful. A single monkey gets picked off right away. And humans are the same. We don't have claws. Well, not really. We don't have claws. We don't have teeth. You know, all what we have is each other. So the social group is hugely important. So social scrutiny can feel like a life threat, and in a sense, it is kind of a life threat. So think about it. I'm sorry, what's your name? Margaret. Tony. Okay, any other discussion? Yes.
First, what you were just mentioning, I was actually just last night working on an essay, and I noticed that the whole structure of humanity leaves us completely dependent on each other. Like, I cannot exist alone, you cannot exist alone. If you try to isolate yourself from all society and go off and be a hermit, you're not going to make it. Like, not only are you, will the nature get you, but your psychology will not allow you to exist in that way. And then as to the slides, this is exactly, I just completed a research project on meditation, and the last thing that I looked up was deep breathing, and it's like, wow, deep breathing is really important, and it affects the amygdala, it affects the hippocampus. Cortisol is the primary stress hormone, and oxygen breaks it down. When you get cortisol toxicity, it actually causes your amygdala to hypertrophy and your hippocampus to atrophy, and so you get scared and confused more and more easily, and when stressors are always there, it'll actually remodel your dendrites so that they're not able to pick up serotonin and dopamine. They're only picking up cortisol and other stress hormones.
That's true. That's true.
And so you have to stop, and the one thing that breaks down cortisol is oxygen. So you have to stop and take those 10 deep breaths, and that's so important.
That's right.
That is such a beautiful segue. Come on. Thank you, sir. Well, we're a small enough group. Maybe we should introduce ourselves. Is everybody cool with that? I'm Tony.
I'm Tony.
Tony? Hey! Need another one. That's true. Lee.
I'm Alex. I have a brother named Lee, so that came naturally.
My son's name is Tony.
And what's your name, man?
I'm Denise.
Denise.
I go by Shook because I come to shake things up.
Yes, ma'am.
I'm Matt.
Hey, Matt.
Dante.
I'm Edie.
Edie.
I'm John.
Edie's ice cream. I don't have the money.
I'm Serena. I'm Melissa.
I'm Adolph.
Lucille.
Okay, well, that-
Sarah.
Oh, sorry. Oh, sorry, there you are. Yeah.
Hi, I'm here.
I need new glasses. So we all, so it's great to be here with everybody. And, not Alan, what's your name?
Alex.
Alex. Alex's point about deep breathing and cortisol and all of that is a perfect segue, because now Lee is going to show us how some breathing stuff.
Oh, see, look at this.
We're just going to do a little breathing and moving,
Nice.
but we're mainly going to do that to feel. The point of a lot of what I do as a yoga instructor is to renew sensation. And when we are with our own sensation, we're present and we're mindful of what's going on in ourselves, and then we're positioned to make better decisions for ourselves, feel safer, and be able to hear and take in things around us. So I start my practices, and you're also, let me just say, I'm going to invite you to join me in a little practice, but always listen to the internal teacher. Your own teacher inside is the one that you want to respect. So if I make a suggestion that isn't right for you, stay with your breath, and we'll go from there. Also, I like to take my shoes off, but that's okay, because I like to feel my feet. And when we feel our feet, you can do it with your shoes on. When we feel our feet, there are a lot of strong connections to earth that are very securing and help us feel safe. So you got support under your hips from your chair, you got support from the earth under your feet. And then I like to roll my shoulders forward, let my chin come down on my chest. And as I inhale, I lift my shoulders up to my ears. And as I exhale, I let them roll down my back. And my palms roll open, and I let them find support on my legs. So then make any adjustments so you feel really comfortable and at ease. And I begin each practice with noticing myself. So just take a moment. You can gaze down. You don't have to watch me. Just notice your own breath. You may notice it entering through the nostrils, moving past the sinuses, into your chest, maybe your belly. And as you exhale, you can feel your shoulders and ribs release down. Maybe your belly relaxes toward your spine. And maybe you'll notice the air temperature as it leaves your lips or your nose. Just notice. Notice your own breath as it is right now. And then if you want to, next time you're ready to exhale, pretend you're blowing on a feather, very gently through the lips. And just by doing that, you can begin to relax yourself and calm your mind. Sometimes, not always. Just blow through the lips. That'll extend your exhalation and keep just inhaling gently through the nose. Do 2 more of those. And then return to your own natural breath and notice any difference. When we stop letting our brain tell us how to breathe and we just go back to our usual pattern, sometimes we notice a difference. So take it all in, notice what you notice, and then we're going to move a little. So I'm going to release my hands off my legs, and I'm going to reach back to find the back of my chair, if you can find that. I like to open my heart and open my throat and let the front of my body have a little more space. And then I let go of the back of the chair, round my back so the back ribs can open, and come forward a little bit. And then I reach back again, open the front of the body and inhale. And then I'm going to release my arms and feel as you lean forward, you can move weight onto your feet. So you have maybe a lot of weight in your hips. Start to move the weight onto your feet. And when you're ready, you can get all the way on your feet, and if you want, you can come up. And don't come all the way up just yet. Just take a moment here and see if you can feel the muscles in your low belly that help you exhale come on, maybe on the insides of your legs. And then press your feet down and lift all the way up. Open your arms out wide, and we're going to fold at the hip, if that's comfortable for you. And exhale over. Exhale, empty out, empty out, empty out. And then inhale, let your arms go open wide again. Press yourself back up. And exhale, release. And you're back to what I call the mountain. So the mountain is active on the outside, calm on the inside. So we'll do a little side stretching. Inhale, your arms come back up. And take your left wrist in your right hand. And exhale over to the other side. Inhale back up. Change hands and wrists. Exhale over to the other side. Inhale back up. Reach for the ceiling. Exhale, fold, swan dive over. And this time after you empty out, we're going to let the legs get real strong. Keep the top of your body real relaxed in the arms and just slowly push up. Push your big toe into the floor. Slowly roll your spine up. Let the back get all this space until you come back to standing again. Then take your hands back and make sure your chair's still there. Because you never know.
Yeah.
Then lower your hips back onto it. All right. And then we'll do, so we've done flexion, extension, 2 side bends. There's 6 magical moves for the spine that keep the breath space in the center open. The last 2 are twisting. So if you extend your left leg out, and then fold your knee, reach around with your opposite hand, we're connecting both sides of the body, and twist your belly into your thigh. And inhale, and then exhale, wring out the center for all that delicious turkey sandwich or whatever the heck you ate. And then release, extend the leg out. Exhale, slowly lower your foot back to the floor. Other side. Reach out through the right leg, fold the knee, wrap around with the left arm. Inhale, let your head reach tall to the ceiling. And then exhale, wring yourself out like little washcloths. Inhale, open your belly, fill it up. Exhale, wring it out. And then release your leg to reach forward again. And then slowly exhale. And you're back to where we started. We're going to finish this little exercise with, I think, of a breath that Tony thinks is very calming and balancing, called square breathing or box breath. There are 4 phases of breath: inhaling, pause, exhaling, pause. So we'll just do those Do it at your own rate that you feel comfortable, but I'm just going to show you how I do it. So we begin, feel your feet, feel your own breath before you start anything else. You're going to inhale, 2, 3, 4, pause, 2, 3, 4. Exhale, 2, 3, 4. Pause, 2, 3, 4. 2 more. Inhale, 2, 3, 4. Pause, 2, 3, 4. Exhale, 2, 3, 4. Pause, 2, 3, 4. One more. Inhale, 2, 3, 4. Pause, 2, 3, 4. Exhale, 2, 3, 4. Pause, 2, 3, 4. And then just feel what our brief movement and breathing together has done for you. Notice what there is to notice in your own body and mind. And thank you for sharing this practice. Tell me that's something you want to share.
Yeah, it looks like we have 10 minutes. So should we do the third one? Yeah, I think we did. So now, so having done this sort of breathing, and also it's really important, I'd like to invite us all to kind of notice what's going on in the body. What does this feel like right now? In the state of, for many of us, maybe relaxation, or calmness, real parasympathetic tone, real calm. And I'm going to apologize ahead of time because I'm going to shake things up. Oh, we have shook here. I'm going to shake things up a little bit. And because what I'm going to like to purposely induce a change. The way I'm going to actually activate it is threat responsive pathways. So I'd like you to think of a minor irritant. Nothing big, not a trauma, no big blowout. But something that happened, like, maybe somebody cut you off in traffic, or you were at the grocery store, and then, your lane, it was like, can we get a manager for a check there? And it's like, no, really? And you're stuck there. Or somebody, you ask somebody to do something, say, yeah, I'm going to do it, and then they don't do it. So pick something, preferably the last week. It still has a little bit of juice in it, it's a little bit fresh. Try to bring this to mind, if you're willing. And it's perfectly fine if you choose not to. But if you want to sort of get a little bit of a taste of an irritant, try to bring that to mind and really move it. It should be a 5-pound weight, not a 100-pound weight. Okay, I got something. If you feel a little bit ticked off, or if you feel a little bit sad, or whatever it is, disappointed, notice that. I'll purposely notice, what does this feel like in the body? What is your tell? So we each have our own set of experiences, our own set of responses. So the invitation is notice, what does it feel like to be a bit irritated? Especially when we're nice and calm, and now we're a bit irritated, a little bit, there's an irritant of some sort. And can you say, and it's not pleasant, but maybe if you're willing to say to yourself, well, I'm just going to kind of, that's out of curiosity, I'm going to kind of be okay with this for a minute. It's already here. Is it okay to sort of let it be there for a moment? Just be curious about it. And without trying to push it away, let's just continue to take some, maybe 10 breaths, sort of a normal, but being aware of the breath. Noticing the breath coming in, noticing the breath going out. You might find your breath tends to slow down a little bit naturally. And sort of notice the feeling of irritation that when it dissipates, if it does, just be curious about that. this practice is useful for a couple of ways. First, the idea of being aware, knowing your own tells, knowing when you're starting to get sympathetic activation. You're noticing, especially if you notice it early. Maybe for you, your tummy feels a little funny, or maybe your jaw's clenched, or maybe your shoulders are bunched together. And ask yourself, what can I do to care for myself and be effective? Whatever we're doing, whether at work or with family or with kids or with elders or with colleagues, we're probably going to be more effective than when we're coming at it in a calm manner, not overly influenced by our sympathetic nervous system. Now, let me pass it off to Lee, because the next exercise kind of fits with this one.
So this is just my way of remembering the three-part brain. So I'm asking everybody, just take your dominant hand. For me, it happens to be my left hand, but whatever it is. And imagine this to be the little lizard brain, your little lizard brain that just wants to survive and get to the next day. Very reactive, very jumpy, very worried about everything in the world as a threat. Now imagine your other hand to be your mammalian brain, your nice emotional dog, your comforting dog, and take your mammalian brain, your limbic system, your emotional brain, and calm, pat your little lizard, and let your little lizard know it's okay. You can relax. You can let your heart rate slow. You can let your breathing slow. Now, look around you and make contact without using words with somebody else in the room. And between the two of you, decide, no words, just use your wonderful facial expression and all this good human brain you got. Somebody let go of your little lizard and bring your cortex, your smart problem-solving empathic cortex, on top of the other person's little lizard and limbic system to make a full brain together. So somebody's going to be the lizard and the limbic system, and somebody's going to be the two cortexes that can be creative and problem-solve and calm and help out the other.
Okay. Yes.
And you can make eye contact, and you can just feel the support of the connection that humans are capable Thank you. And that is how we humans problem solve and manage our little lizards. This is how we manage our lizards. Back to you. Yeah.
So thanks, Lee. I hadn't done that one before. She told me about it. That sounds awesome, but I never did it.
But see, they laugh.
I said to him, I promise you a couple people will laugh when they do this.
I can't help the dog.
So this is a way, kind of in a humorous or a kind of cute way, to get them to do this ice breaking and also to connect with, again, the parasympathetic nervous system, the part of our nervous system that feels safe, that wants to share, that's connected, and it is loving. And so I thought as a little gift, parting gift, to do a practice called the Beloved, and it's a little short meditation. 5 minutes? Thank you. Perfect. How about that? And if you like, and this is optional, if you like, closing your eyes, which helps bring awareness inward. Although you can certainly leave your eyes open if you prefer. Again, maybe just noticing the body, noticing your feet on the floor, your legs and arms and back. One invitation, if you like, is to bring to mind somebody that when you think of them, you just tend to smile. You just can't help it, just smile. This can be a person. It could be a person who's with us in life or not. It could be a four-legged person or a two-winged person, any type of person. So dogs or horses certainly apply. And just bring their mind, their face into your mind. And imagine them smiling. they're smiling and they're happy, and you're happy that they're happy. And noticing what this feels like in the body. Noticing your face, noticing your chest, your abdomen, all the muscles in the body. And maybe whatever feelings that you like, whatever intention, perhaps an intention of gratitude or of well wishes or loving kindness, as you think of this mental representation of the beloved. Happy. Well, I'd like to keep going for another hour or so because we've had a lot of fun. I think we got our 5 minutes, so this session is complete, at least it's done. It's complete. And it's really wonderful to meet you all.
Thank you.
Can I say a thing?
Yes, please.
So I mentioned that I had recently completed a years-long research project into meditation, and one of the things that I learned about was a fellow named Mathieu Ricard, whose meditation technique is very similar to what you were just describing. He was part of an EEG study in 2017 with a bunch of Buddhist monks were brought in by scientists to asked to focus on various moods and emotions. And when he was asked to focus on happiness, he went off the charts. He was the happiest person ever so recorded. And so they asked him what he does, and he doesn't meditate like a Buddhist monk normally does. Normally a Buddhist monk that clears their mind and focuses on breath or focuses on a beat or something. And what he would do is what you were just mentioning, is think of someone or something that makes you feel happy. And then don't focus on that person or the thing, because your mood about them can change at any time. Instead, focus on the sensation of your own happiness. Your idea of them is not them. Your feeling about them is really you. And you just focus on that sensation and hold on to it for as long as you like or as long as you can. Yeah. Or as long as you can, and if you can, as long as you like. Yeah.
Well, that's wonderful.
Very good. Very good.